So what I'm going to do is I'm going to discuss with you the concept of MitraClip or clip procedure, which is a minimally invasive procedure to fix the leaky mitral valve. These are different etiologies or causes of mitral regurgitation. Okay, so on the very left side, this is a normal mitral valve. So, you know, with this COVID and virtual patient visits and everything, you know, I came up with some innovative ways of communicating what I'm saying. So I give an example to my patients all the time. I say, you know, heart is like a house and valves are like doors. Okay, so so just the way, you know, door has to open and shut to function normally, that's how the valves have to do. The valves have to open to let the blood go from one chamber to the next chamber, and then have to shut so the blood doesn't leak back. So the mitral valve, as you can see, is sitting between the left upper and left lower chamber of the heart. The left lower chamber of the heart, which is left ventricle, is actually the main pumping chamber of your heart. So the blood needs to come down from the left atrium or left upper chamber of the heart through the mitral valve into the left ventricle or the main pumping chamber of the heart. And then the valve has to shut so the blood doesn't leak back into the left atrium or left upper chamber. In a leaky mitral valve, as Dr. Weiss explained many different reasons why a valve will be leaky, in particular in patients with heart failure, that leaky valve puts extra strain on your heart. So the blood comes down from left upper chamber of the heart to the lower chamber, and then the valve doesn't close well, so it leaks back. So this back and forth of blood puts extra strain on the heart and leads to more heart failure. So that's what's happening in the mitral regurgitation. So there are two predominant causes of, or two bigger types of mitral valve regurgitation. One is when the issue or the problem is with the valve, and that's called degenerative or primary mitral regurgitation. And the second type is when the mitral valve leaflets are okay, the issue is with the structures holding the mitral valve, whether it's the mitral valve annulus, whether it's the papillary muscles, whether it's the left ventricle or left lower chamber of the heart, which becomes bigger. So two kinds of mitral regurgitation. We're gonna focus on the second kind, which is the secondary mitral regurgitation or functional mitral regurgitation, which means that the leaflets are okay, but everything around the leaflets are kind of a problem. Either they're dilated left ventricle, or the papillary muscles are not functioning right, or the annulus is dilated. That leads to leakiness of the valve. So remember the word secondary mitral regurgitation or functional mitral regurgitation essentially means the same. That is the issue in most patients with heart failure, is the functional mitral regurgitation. Next, Rebecca. So when mitral valve is leaky, Dr. Weiss discussed with you different ways to fix it. And one way to fix mitral valve is to obviously do open heart surgery and repair it, put a ring in, put a new valve in, or repair it by cutting the leaflets and stuff like that, which as Dr. Warnick said earlier, Dr. Weiss is the expert and has done an amazing job in this field. But to put things in perspective, one of the procedures the surgeons used to do is called the Alfieri stitch. And Dr. Alfieri, who was a cardiothoracic surgeon, will essentially do open heart surgery, which will open the chest, go all the way to the mitral valve, and wherever the mitral valve is leaking, we'll put a stitch on that, okay? And that mitral valve leakiness will decrease, because if you know exactly which part of the valve is leaking, and you kind of tie the two leaflets at that area, then the valve cannot leak, or it leaks less. So that's what was done with open heart surgery. Similar concept. So this is essentially, you can see there's a stitch there, and that's what's done with open heart surgery. Now, same concept is for the MitraClip. Next slide. So reproducing the same LFE stitch, we came up with the MitraClip system, okay? So what that system essentially does, that we place a catheter from the femoral vein without open heart surgery. We place a 1 to 2 millimeter nick in the groin. We enter the vein, and we take that device all the way to the right upper chamber of the heart, and we make a small puncture in the septum or partition between the upper chambers of the heart and go to the left side. Once you're on the left side, you can see on this cartoon where the clip comes down, and wherever the leak is happening, we place the clip right there, okay? And you can see at the end, towards the right side, the clip is deployed, the delivery system comes out. So that is the MitraClip delivery system right here. So this trial, which was the very pivotal trial, studied patients with mitral valve regurgitation or leakiness of the mitral valve, surgery versus the clip procedure. Now keep in mind, these are the patients who are very high risk for surgery. So in these patients, the MitraClip did extremely well, and that is what led to the approval for MitraClip procedures in mitral regurgitation. Now this particular trial was done in patients with primary mitral regurgitation, not the secondary, not the heart failure ones, but the primary ones. Next slide. So that's how FDA approved MitraClip therapy. In fact, we at Penn are number 2 in the country doing the MitraClip procedure about 15 years ago. Next, please. Now, what happens in patients with heart failure, right? So in patients with heart failure, you can see this is a normal ventricle on the right side. So essentially left upper chamber of the heart, blood comes down to the lower chamber, and then blood gets out through the aortic wall to the body. But what happens in heart failure patients, the ventricle or the lower chamber of the heart on the left side gets big. And as it gets big, it leaks more. As it leaks more blood comes back to the same chamber. More blood comes back to the same chamber, more stress on that ventricle or on that chamber, and that chamber has to work harder. It's already weak, it gets weaker. So this vicious cycle continues back and forth. So patients with heart failure and leakiness of the mitral valve continue to do worse, and I'll show you slides in a bit. So this vicious cycle leads to very high mortality. So people at 1 year, a lot of people who have severe mitral regurgitation and a very weak heart, they end up dying, unfortunately. So next slide. Okay. Right. So see here, these graphs show you that if you have heart failure and leakiness of the mitral valve, the chances are in next few years, an event will occur. And most likely, many people within the next few years are not gonna make it. So mitral valve regurgitation in patients with heart failure leads to worse outcomes, more hospitalizations, infections. Obviously, you're hospitalized, you're exposed to all sorts of infections. You go home and come back in a few months later with another heart failure. So this cycle continues to lead to more hospitalizations and ultimately, unfortunately, death. So bad outcomes when people have leaky mitral valve. Next, please. So what are the options, right? So Dr. Warnick and Dr. Baldi probably went over the medications, which actually work extremely well. And the heart failure specialists like Dr. Warnick, they have really an art to manage patients with heart failure with medications. And many times, all they need is really a good medications, right? But if that doesn't work, you go with the CRT, which is done by electrophysiologists at our center. If these things are not working, then obviously there's option for Dr. Weiss to open the chest and put a new valve or repair it and do a ring and fix the leakiness of the valve. But more advanced or relatively newer technique is to clip the leakiness of the valve without any surgery, essentially minimally invasively from the groin. The procedure itself takes about 1 to 2 hours, and patient goes home next morning. So that's the clip procedure. So these are the typical options for a patient who has heart failure and mitral regurgitation. Next, Rebecca. Right. So I'm gonna take a deeper dive into CoOp trial, and because this trial really is the foundation for management of mitral regurgitation in heart failure patients. I don't think we have any other trial which is so meticulously done that every aspect of this trial really is a foundation how to manage a mitral valve regurgitation in patients with heart failure. Okay, so in this trial, what we did was we had patients who had optimized medical management. So every patient in this trial was asked to see a specialist for heart failure like Dr. Warnick. And that was mandatory, and that was not what was done in the MitraFR, which was a European trial. What Steve mentioned, that it did not help because the trial was absolutely, not well designed. So every patient was seen by a heart failure specialist, and then that patient was randomized between a clip procedure or just the conservative medical management, which means just medications alone, to see if adding the clip and decreasing the leakiness of mitral valve, would that help? Next, Rebecca. So I'm not going to go through all these criteria. All I'm going to tell you is that this trial was done carefully, and it should have been done carefully because heart failure patients are sick patients. So if a patient had missed the diagnosis of leaky mitral valve for whatever reason, it hasn't followed, and that patient has gone too far, and the heart is now too weak, those patient was excluded. The concept was there's not much to do for those patients because essentially the train has left the station. So they went too far. So that was the one major exclusion or inclusion, that the patients were carefully selected who would most likely benefit from the clip procedure. Next. Yeah, so similarly, the exclusion criteria was if the patient had, life expectancy a year for other reasons, cancers, which we do for most trials. But the most important thing to remember is the trial was done carefully to select those patients who would benefit from the clip procedure. Next. So you see here that the green bar or graph shows you patients who had the medical management and clip. The blue graph shows you the patients who only had medications, right? So you see at 2 years, at 24 months, patients who had clip had less heart failure, right? And very interestingly, you see in the very beginning, the graph started to separate within a month. So the effectiveness of the clip procedure starts immediately, because what you're trying to do is you're trying to decrease the leakiness into the left upper chamber of the heart, and the strain on the heart decreases immediately. And you see the difference right away. So at 2 years, there was a remarkable difference between the two cohorts. Next. You can go to next. Yeah. So you can see here death or heart failure hospitalization significantly lower with patients who had a clip therapy, okay, compared to patients who did not have a clip therapy. Next. More importantly, the patients who had a clip, they had better survival. So on the left side says all-cause mortality, which means more people died if they were just on medications compared to if patients had medications and a clip procedure. Next. Okay, and this is my last slide. So I'm gonna take a few seconds here just to go with all of you, and Clay, please pitch in if you wanna make any comments. So this is an amazing slide to show you. If you look at all these trials, this is called number needed to treat to prevent one all-cause death. One all-cause death, okay? So which means, just to paraphrase, how many patients you need to treat to prevent a death, okay? These are multiple trials. Many of these trials, you know, I mean, Clay is very familiar with the heart failure trials. You know, this is a FISES trial, again, a heart failure trial. Look at the number needed to treat. You need 22 patients, 50 patients. You need to put 50 patients on a medication to prevent one death. Look at on the right side for the clip therapy. You only need to treat 6 patients. So 6 patients saves 1 death. I only know one more trial. That was the TAVR trial in prohibitive or high-risk patients where the number needed to treat was 5. This is the second trial I have come across. You only treat 6 patients to save a death. That is remarkable trial telling us that we have a great news for patients who have heart failure and a leaky mitral valve. And we offer this therapy, you know, within our system. We offer this therapy at downtown centers. At some point, we'll offer this at Chester County Hospital. The one last thing I want to say is that all treatment strategies for these complex patients, our approach is a heart team approach, which means that, you know, we discuss as a heart team, myself, Dr. Weiss, Dr. Warnick, Dr. Baldi, and Dr. Vigilance. We all kind of put our heads together and say, what's the best thing for this patient? And if the best thing for the patient is to do a clip therapy and minimally invasive therapy, that's what we offer. If the right thing is for that patient and the best thing is to go for open heart surgery, then we have a heart team approach and we recommend that. Thank you very much.